was a student, PhD student, actually in the US, and I was visiting India, and I felt quite ill, and none of the doctors that my family knew were able to diagnose it, and I was taken to Apollo in Madras, and Dr. P.C. Reddy actually was the one who diagnosed it. It was typhoid, and it's certainly wonderful to be back in the Apollo fold in some ways, and hopefully I'll remain healthy. But it is certainly a wonderful memory of very good diagnostics in those days. And as we'll see, that whole science and capabilities of being able to pinpoint and provide better healthcare is what we're going to talk about. And I'll basically focus on what this whole genomics revolution is about and what Strand is providing, right? Well, first of all, I want to point out that for Strand, this has been a 14-year journey, right? For about the Human Genome Project was announced, and the first results of the Human Genome Project came out in 2001, 2000, and that's when we started Strand. And so it actually took about 10 or 11 years to actually do all the the spade work that was needed to then think about even bringing it into the clinic. So in 2011 is when we actually made that transition, and so understanding the molecular basis of life and it continues to be the research challenge, but the Human Genome Project gave us that ability. And it's as big a breakthrough as the internet or any of those things. So it's important to keep that in mind. And the clinical challenge is, of course, bringing molecular insights to medicine, right? And that is something that we embarked on about maybe 3 years ago in 2011, and since then we've been working at it. So actually needed to understand the molecular biology of disease and find the right biomarkers and so on. And then once we brought it into the clinic, this is more about testing, and being very accurate in interpretation, and obviously